think we're going to go ahead and get started. So good morning or good afternoon. I am Dr. Lisa Waddell, the Chief Medical Officer for the CDC Foundation. And it is indeed my pleasure to welcome each and every one of you to today's event brought to you by the CDC Foundation. We have an exciting agenda for you planned today. First, we're going to hear from CDC's Dr. Amanda Cohen, who's going to have a conversation with our President and CEO, Dr. Judy Monroe. Then we will speak with public health leaders from Chicago and learn about their important work in the vaccination effort. And then after that, we'll do some polling to get to know all of you a bit and learn about your needs. And then all of the panelists will join in a conversation and a robust question and answer period facilitated by our CDC Foundation President and CEO, Dr. Monroe. So next slide, please. So a few important webinar tips. Please use the Zoom chat feature for any comments that you might have. And then please use the Zoom question and answer feature to ask the panelists any questions that you might have. We'll do polling over Zoom, so you'll be able to answer the polling questions right from the webinar. And also after this presentation, we'll post the slides and a recording of today's event on our CBO resources webpage so you can access those materials there. Next slide. Also, in case you haven't seen it yet, the CDC Foundation has created a special COVID-19 resource page on our website specifically for CBOs. It contains links from trusted sources to things like toolkits, flyers, and other communication materials that can help you as CBOs in your COVID-19 response work, including efforts to support the vaccinations. It has links to our previous webinars to also view at your convenience. Also, the speaker bios and the agenda for today's webinar are already posted there. We may have been having a few technical issues with the site earlier, but if that's still an issue, it will certainly be resolved very quickly. The link to access the materials is being posted in the chat as we speak right now. So next slide. Okay, so now we are ready to proceed with our program. We are extremely pleased to welcome Dr. Amanda Cohen as our special guest for today. Dr. Cohen is a physician currently working as the Chief Medical Officer for the CDC's COVID-19 Vaccine Task Force. This is an essential, a critical team for the vaccine strategy and rollout here in the United States. Dr. Cohen will provide a COVID-19 update and highlight some tools for success as we collectively work on equity in vaccinations. After Dr. Cohen's presentation, she will engage in a candid conversation with our CDC President and CEO, Dr. Judy Monroe. So again, we are so pleased that all of you have joined us today. And now I am going to turn the program over to Dr. Cohen, who after her remarks will be joined in a conversation with Dr. Monroe, the President and CEO of the CDC Foundation. So let's get started. Dr. Cohen.
Great. Good morning, Thank you, Dr. Waddell, and good morning, everyone. It is really an honor to be here to talk to all of you today. I just can't express my appreciation and gratitude for all the work you guys are doing to keep your communities as safe and healthy as possible over the course of this pandemic. I'm going to talk to you a little bit today about the COVID-19 vaccine program implementation and talk to you about the importance of community-based organizations and how you can be part of the efforts that are really an all of society effort to get our country vaccinated. Next slide. So this is the most up-to-date data around the number of people who have been vaccinated for COVID. We now have over 20 million people have been vaccinated. This is about 6% of the US population. And we have nearly 4 million people who have received their second dose, so would be considered totally vaccinated. As you can see, there have been 47 million doses administered in 24 doses. I'm sorry, 24, yeah, 47 million doses distributed and 24 million doses administered. And one of the things that is really important is how to get doses in arms as quickly as possible once they've been distributed, while also making sure that we don't leave anyone behind. We have to be laser focused on health equity as vaccination groups expand. Next slide. We all know that vaccination is a safer way to build protection. Getting the virus that causes COVID may offer some natural protection and immunity. However, we don't know how long this protection lasts. The risk of severe illness and death from COVID far outweighs any benefits of natural immunity, and vaccination is the safest way to help you build immunity without the risk of severe illness. Next slide. The problem is we still have a large number of people who either don't trust these new vaccines, don't understand these new vaccines, need more information, and need to be engaged in discussion around the importance of getting vaccinated. And finally, don't have easy access to vaccines. So we know that the overall acceptability of COVID-19 vaccine is moderate. Studies have shown it's between 42 and 86%. And factors that weigh on acceptance include concern about side effects, whether or not the vaccine will work, and how long it will work for, an individual's perception of risk, and concerns about potential costs of the vaccine. We also know that vaccine confidence is lower in communities of color who have who are most vulnerable during this COVID pandemic, but also have had long-standing mistrust of the healthcare community. Next slide. So this is a slide that shows differences in vaccine skepticism in different groups. And to clarify, this is not data about COVID vaccine. This was a study that was done a year and a half ago overall. But this demonstrates most people do support vaccination, but it does vary. Vaccine skepticism is higher in persons of color, including Hispanic and Black persons. It also is higher, or vaccine confidence is lower in persons with lower income and lower education status. Next slide. So this is CDC and its national strategy to reinforce confidence in COVID-19 vaccines. And this was put together after after doing lots of listening sessions and focus groups to try to really get at the challenges that are in the community in terms of getting vaccinated. Trust was a major issue when we talked to people about their concerns about getting vaccinated. And so one of the key factors in our Vaccinate with Confidence strategy is to continue to reinforce trust. In doing this, we need to regularly share clear and accurate information about COVID-19 vaccines and take visible actions to build trust in the vaccine, the vaccinator, and the system. And so we need to be out there as much as possible, sharing all the information we know about these vaccines and being clear about what we don't know and what we're still learning. We also need to empower healthcare providers by promoting confidence in healthcare personnel, both in their own decision to get vaccinated, as well as to recommend vaccination to their patients. We have millions of healthcare providers, and I'm not just talking about doctors or nurses, I'm talking about anyone an individual encounters when they're getting their health taken care of. Really across the healthcare sector. If all of those persons who we know communities and families and patients look to for healthcare advice, if all of those individuals would share their confidence in getting vaccinated with those around them, that in and of itself would do so much to help build confidence in this country. But finally, we need to engage communities and individuals. So we need to engage communities in a sustainable, equitable, and inclusive way using two-way communication to listen, increase collaboration, and build trust. Frankly, we don't, the immunization program hasn't had the same experience of health disparities. While we know that adult vaccination, we have always seen health disparities, pediatric vaccines, we've seen very similar coverage across all racial and ethnic groups. And so, this is really a new way for us to think about vaccine confidence. It's not just dispelling new misinformation, it's really that community level engagement. And it's what we need from our community-based organizations to really help us support, because people don't want to hear CDC come in and tell them what to do. People want to have conversations, and they want to have conversations with people they know and trust. And that's all of you on this call today. Next slide. So at the link below, we have a communication toolkit for community-based organizations. And these are some of the things that we have. We have slide presentations, key messages and FAQs, and posters. These are for all of you to use in your communities, adapt as works best for you. And we encourage you to reach back out to CDC if there's more information that you need. It's also really important for community organizations to work closely with their jurisdictions. And Dr. Monroe and I will talk a little more about that in our discussion. But if you have questions about how you can best engage, we strongly encourage you to reach out to your local health department, your state health department, and you can always connect with us through CDC, and we can make those connections back to your health department. Next slide. This is a little bit more information on the vaccine communication toolkit. It includes customizable letters. So for example, if you are a community-based organization that is not a healthcare provider, but provides childcare, you could send a letter out either via email or printing and putting in people's mailboxes about the importance of those parents to get vaccinated. Of course, not right now, because we still have limited supply and we're really focused on older adults right now. But you can also have newsletter content and social media content. Apologize. Next slide. Great. We also have these materials are available in multiple languages. They're not available in every language. We did a survey to try to find out which would be the languages that that jurisdictions and communities would like things translated into. And we got over 22 languages, which is just really says a lot about the diversity in our country and is amazing. Some of the languages, honestly, I had never heard of. But we do have materials in Arabic, Spanish, Russian, Korean, and Chinese, and Tagalog, and Vietnamese. And all of these materials are available at that same link. Next slide. And I'll end there, and we can start the discussion. I apologize if y'all can hear my dogs barking in the background.
Yeah, so Dr. Cohen, thank you so much for that great presentation. And it is the world of Zoom that the dogs want to get in on the action. So it is the world we're living in. For our audience, we are putting the link to this toolkit in the chat for you, and you can also find it on our web resources page. So thank you for describing the CBO toolkit. I want to start with that. And I'm sure that our CBO audience today is wondering if there are other specific activities or specifically funding opportunities that CDC has developed or announced to the states that might be helpful to the CBOs as the trusted messengers and helping folks access vaccines. Could you speak to that a little bit?
Yes. And let me actually address that from two perspectives. So in many types of CBOs are critical in terms of being trusted messengers, but we're also hearing from CBOs who want to host or sponsor vaccine clinics and need resources to do that. So while most of those CBOs would coordinate and connect with a health system, there's still sort of unintended or unexpected costs like bathrooms and things like that if you're setting up an outdoor clinic. And we want to make sure that there's support for that as well. So we are in the middle of providing jurisdictions with a bolus of funding to get COVID vaccine in people's arms. And that is an overall amount of about $3 billion that obviously is spread out over the whole country. So it's not that much per jurisdiction, but it is still, it's coming late. We wish this money had been available months before, but it is here now. And so we need to get that funding used. As part of that, there's a 10% minimum under this award that jurisdictions must allocate 10% of these funds to high risk and underserved populations. We are putting out what we call a playbook amendment to our jurisdictions that is focused very much on community engagement and working with CBOs. And so this is not quite out it should be out by the end of this week, but jurisdictions are expected to identify, reach to, and fund local CBOs and community leaders as part of these community partner networks to support vaccination efforts in their community. So we do strongly encourage you as a community-based organization to reach out to your jurisdiction. You may not hear back from them this week. They're just getting going with all of this. If you don't hear back from them, reach out to them again in a week or two, because as you know, they are, there's just been, everyone is very much focused on getting through each day right now. But we do need to be looking towards the future. And so we're hopeful that this funding bolus will allow jurisdictions to do that. If you're also connected to a national organization, look to your national organization because CDC is directly funding some national organizations to do community engagement. And those groups haven't been funded yet, or some of them have been notified and some of them haven't. But I encourage you to reach in both directions.
Very good. We have time maybe just for one quick question here. And I wanted to ask you something about vaccine, the concerns about vaccine being distributed. There are a lot of questions about, the vaccines getting to communities of color and those that are hit the hardest. And then there's also a lot of questions about the 65-year-olds starting to get it, but 85-year-olds not getting it. What's CDC doing about that? And can you give us a quick snapshot of that?
Yeah. This is the issue that is keeping me up at night right now. It is as we are expanding and we're trying to get more vaccines in arms, we're also leaving people behind. And some of those people may be people who didn't accept vaccine. We saw very low uptake in long-term care facility staff. We need to go back and keep offering them that vaccine a week or two later or 3 or 4 weeks later. We are also seeing that the elderly are getting left behind. They can't access technology in the same way as others, not all older adults, but many. There's issues with illiteracy. If all of you have tried to get an older parent or friend an appointment to get vaccinated, you will see how hard it is. And there's many people who don't have people who can help them do that. So one of the most important things we want to do is help support our FHQCs. They are a critical group to make sure that we continue to get doses into the right populations. We also have, we have to look at our data better. So another thing that CDC is committed to doing is showing our data, both not only on race and ethnicity, but also on by social vulnerability index. So looking at it by socioeconomic factors and other factors. Are we getting as many doses in arms in those communities as wealthier communities? So some of that data we're hoping will drive jurisdictions to try to make efforts to get vaccine into communities that are most needed. But what we're also hearing is that even if that vaccine is in those communities, people are coming from outside the communities to reach those vaccines. And so some of this is going to require more work, frankly, and we are making efforts, but we still have to address these problems on a daily basis.
Yes. So, well, thank you very much. This wraps up this portion, and we're going to see you a little later in the program. We're going to bring all the panelists back at the end for some Q&A. So, but thank you for this really important information. So now what I'd like to do is move on with introducing our next guest. And these days, we do hear a lot about bad news. And of course, there is a lot of bad news. But we hear less about the bright spots. And I'm here to tell you that there are some real bright spots in the national effort to control COVID-19 and in today's vaccine response. So to that end, I am so pleased to introduce our guest from the Chicagoland Vaccine Corps Partnership. Today, we're joined by Rachel Reichlin, Sheila Regan, and Marina Del Rios. The Vaccine Corps Partnership is a new collaboration of multiple stakeholders, building on their past work with communities. They're now focused on ensuring that all Chicagoans can access the COVID-19 vaccine. So first, we'll be hearing from Rachel Reichlin, who will tell us more about this unique and innovative partnership. And at this time, Rachel, I'm going to give you the floor. Welcome.
Thank you so much, Dr. Monroe, and to the CDC Foundation for inviting us to participate in this important conversation. The Chicagoland Vaccine Corps Partnership is being incubated as part of the Health First Collaborative hosted at Michael Reese Health Trust in Chicago. The partnership serves to coordinate resources and learnings to ensure that everybody in our region can make an informed choice and access the COVID-19 vaccine, while at the same time strengthening our public health workforce. Next slide, please. As a public foundation focusing explicitly on health, we have built key relationships throughout 2 decades of grant making as we strive to ensure all Chicagoans can live healthy lives. We do this in 3 ways: incubation, grant making, and advocacy. Incubation and advocacy are relatively new for us since transitioning to a public foundation a few years ago. Next slide, please. As an incubator, 3 facets of our program allow us to be especially nimble. 1, our deep relationships and expertise across our partners, both funders and grantees. 2, an expedited review process. And 3, flexibility in our staffing capacity to prioritize new work. We can also draw on our advocacy program to amplify key learnings from our incubation efforts, another asset of being a public foundation. Next slide, please. In early 2020, in response to the twin pandemics of systemic racism and COVID-19, a group of funders formed the Health First Collaborative with the intention to support community-led demonstration pilots that can be replicated and or scaled to address the root causes of racial health inequities and improve the physical, mental, and social well-being of all individuals and families in the Chicagoland region. To date, this effort has 12 participating foundations, partners from Chicago Department of Public Health and Illinois Health and Family Services, 2 community advisory councils, both in English and Spanish, and 2 hubs of activity, counting the emerging Vaccine Corps partnership as one of the hubs. The Health First Collaborative in July and has raised just over $4.5 million to date, the majority going to stand up a multi-year effort for Hub 1, which focuses on community health centers as hubs for health transformation. We continue to actively fundraise for Hub 2. The pilots receive wraparound support, including evaluation and policy and advocacy specialists, to take their learnings to scale and push for just systems change. Through this effort and aligning the work of Hub 1 with public initiatives at the state and city level, we were able to accelerate connections to the right people as vaccines became the focus. Next slide, please. In September, together with Michael Reese's grantee partners at the University of Illinois at Chicago, we started convening health providers and community leaders engaged with hyperlocal mitigation strategies through trusted messengers. As interest and traction grew at this open table, the Health First Collaborative engaged partners in health to help build out the governance and infrastructure for communities to be centered and the emerging workforce to be supported. PIH brings a combination of technical assistance with respect to epidemics, community engaging and organizing capacity, and experience liaising with the public sector. Partners in Health were already partnering with both Illinois and Cook County Departments of Public Health on COVID mitigation efforts. At the right of this diagram, you see a few emerging work groups of the VCP, or the Vaccine Corps Partnership. These are just now being formalized to implement the goals of the Vaccine Corps Partnership, which are to 1, define, identify, and mobilize trusted messengers in communities prioritized by rates of COVID-19 spread and mortality. 2, engage community members in building a communication and education campaign developed to align with the concerns and values of specific communities. And 3, design a long-term model for community-led development of a sustainable public health workforce that employs bidirectional or two-way communication between the public sector and communities. The VCP hosts weekly calls where health departments at the city, county, and state level share updates and next steps. The Vaccine Corps Partnership works to align messaging efforts and create a space for interinstitutional collaboration. In addition, the weekly calls, Partners in Health will help, through the weekly calls, the Partners in Health will help develop mechanisms to share out learnings and insights, bringing visibility and transparency to what we find and learn. This week, there were over 90 participants on the weekly call. It's my pleasure to introduce 2 community leaders who will speak more to the work on the ground and their engagement with the Vaccine Corps Partnership. Sheila Regan is the Chief Operating Officer for Aclivis Incorporated. Aclivis is a community health organization focusing on the health and well-being of individuals living in Chicago's most vulnerable neighborhoods. And Dr. Marina Del Rios is Director of Social Emergency Medicine and Associate Professor of Emergency Medicine at the University of Illinois, Chicago, and is also the chair of the Health and Policy Committee of Illinois Unidos. Illinois Unidos is a cross-sectoral partnership of elected and appointed officials, health professionals, and leaders of community-based organizations that aim to stop the transmission of COVID-19 and address the pandemic's devastating public health and economic impact in the Latinx communities.
Thank you so much. Thanks. Thank you for sharing. So I'm going to move to some questions here now. And Sheila, if we could start with you. One of the goals of Vaccine Corps Partnership is to use the model of trusted messengers to gather and then disseminate information. So could you talk to us about how and why that model works and discuss some of what you're hearing about vaccines in communities that your team is working with on the ground?
Absolutely. So our strategy and our methodology for providing community health to marginalized communities in Chicago is by training, hiring, and equipping local leaders with the information and the skills to get the information out to the communities from which they hail. So in our case, our core focus is violence prevention, but we address any related health issues and any other health disparities disproportionately affecting primarily African-American communities in Chicago. So the trusted messengers for us are Indigenous leaders that are selected by a panel of individuals from the community to be on a part of our team. So really you have to be the people's champ to be appropriate for an Aclivis team. And it's leaders, but also regular folk. So in a sense, you know, we're providing messaging to individuals in the community who identify with the person the message is coming from. So it doesn't feel like sort of a top-down process of mandating what needs to happen or telling you what it's going to be. It's more a dialogue and an understanding between people that relate to each other. So there is a lot of dialogue going on about the vaccine itself. There's a fair amount of resistance or skepticism. And I would say that, you know, the questions and the concerns that I've heard are very reasonable. People have asked questions about, well, if this technology takes a long time to develop, then how is it possible they have a vaccine in 1 year? How do I know it's really effective? How do I know? I've heard actually a fair amount of skepticism that the videos online are fake when they see people, leaders getting vaccines. So how do I know that wasn't a water shot that they received? And I'm saying that's a fair question. I couldn't tell you I know. So I think that, our approach is always to be respectful, non-judgmental, meet people where they're at, and validate their concerns, because I don't think their concerns are unreasonable.
Wow, thanks for that. Yeah, it's very sobering. We've got a lot of challenges. Dr. Del Rios, Illinois Unundos was formed in response to the devastating impact of COVID-19 on Latinx communities. Can you talk about some of the work that the Illinois Unundos has done with Latinx communities most impacted by the pandemic, and how that work is foundational for an education campaign around vaccines?
Sure. So one thing to note is even though I, as a physician, and sitting here on this panel representing the membership of Illinois Unidos, it's really community voices that drive the design, implementation, and leadership of all of our efforts. All of our action plans have been very much data-driven and informed through crowdsourcing of the diverse membership, which includes community-based organizations, health promoters, and also a broad network of health professionals that are not only Latinos themselves, but also that actually work in the community, that work in the FQHCs of the community, that volunteer for a lot of the community-based organizations. We've had quite a bit of success in some of our work up to the point of vaccine education and distribution. So the community came together in response to the COVID pandemic. And so a lot of what we've done is advocating for resources for our community, understanding that a lot of these community-based organizations have challenges and that may not have the infrastructure to apply for grants that are from federal and state funds. Also, there's a lot of people in our community that don't qualify for federal relief funds because they're undocumented. And so advocating to ensure that there are local resources, philanthropic resources that are being tailored to address those very real concerns and challenges in the Latino community. And what we've been able to do is garner resources to educate our community about CDC guidelines to protect themselves for community transmission, right? Mask wearing, physical distancing, how to keep yourself safe at work. We've also been able to advocate for resources for essential workplaces so that workers who have had to continue to go to work, that they have appropriate personal protective equipment, that they're given paid time off so that they can recover when they're sick and so they can properly isolate and not not infect other people at their workplaces. But I think that the common thread in all of this is really focusing on the fact that any efforts to eliminate these health inequities really must center the voices of those who are most burdened, and that those most burdened must be the ones that are empowered with the resources to lead such efforts. So really it's been about having people like me who have the privilege of being able to have conversations with folks like the CDC Foundation or like the Michael Reese Foundation to speak alongside the community and not on behalf of the community, which is often what a lot of folks make the mistake of in doing, and really not hearing out what the community needs, but rather just assuming that certain things are possible. If I could make one comment about vaccine hesitancy. Sure. I think if you look at the percent of people that are willing to take the vaccine in these communities, it's a lot higher than what you would think based on current vaccine distribution efforts. And this really speaks to not so much, the biggest barrier probably is not hesitancy. I would say it's definitely not vaccine hesitancy or fear, it's more access. And so I think this is really what we've been trying to push for, is increasing access. And one of the things that Dr. Cohn mentioned, for example, the technology barrier that a lot of our communities have, that is a very real barrier. There's also just the fact that a lot of these folks are essential workers who don't have the protection to take time off to get vaccinated, to recover from side effects from the vaccine, to even sit through and make appointments. And so a lot of what we've been advocating for is also ensuring that as we think about vaccine distribution efforts, that we're really keeping in mind an equity and a justice standpoint, and understanding that the systems that we have in place right now don't work for everyone, and they certainly don't work for these marginalized communities.
Yeah, thank you for that. Really important points. So we're going to come back to you all a little bit later and bring everybody back for more Q&A. But at this point, we're actually going to turn to our audience. I'm going to turn things over to my colleague, Sharon Moffitt, so we can learn more about who's in the audience today and hear from you about the challenges that you're facing in your communities and what you're doing around COVID-19 vaccines. So if Sharon Moffitt is available to maybe take it away for our polling, and then we'll come back to the panel at the very end.
Excellent. Well, again, welcome everyone. And the next part of our webinar is very important. For those of you that have joined us in the past, you know that we've used polling to help inform not only our current work, but also our constantly evolving work in supporting and building the capacity of community-based organizations. We really want to hear from you and learn from you. And let me just say, the chat already is so rich with so much information. But now we're going to move into a more formal polling. And if we could have the next slide, we're going to ask you one of our very first questions. And this is an easy one. Select only one. We really want to understand who's in our audience with us today. So if you could note what area your organization is representing. You'll see there's really quite a range here. Hopefully you can find one that relates to your organization. Use the chat box if you don't see any of your representation here. And in just 10 seconds, we're going to close the poll. So simply on the screen, make your selection, submit one. Don't forget to hit submit. And then we'll quickly, in 10 seconds here, close the poll, and we'll pull up the results. Takes just a minute as we gather all the input from individuals. And I do note several notes here in the chat box. So thank you for helping us add to this list for representation. And I will call out that it's very important that we understand who is participating in our audience. So we're just waiting for those final submissions. And sometimes we have a little delay here, and that's in part because we're allowing time for you all to note. And so here are our results. So 28% of our audience today are for community-based organizations. You'll see many are, 17% are from public health at the state and local level. We also have representation from health clinics and faith-based organizations. So let's go on now to a more meaty question. This is one I want you to take some time to read. We want to really understand what the specific attitudes about vaccination in your communities are. Please select the top 3 choices, those that come to the top for you as you look at these. I'm going to read just a few of these as you look through these. Again, select 3 and don't forget to hit submit. But we're looking at attitudes such as vaccines work and they're an important tool to protect our community, or people have indicated they'll do the vaccine after someone they know has received it. Also, issues of and attitudes of mistrust of vaccine development. We heard this a little earlier. Mistrust of government. The Tuskegee question, I think, was actually raised in one of our chat questions. Fear of harm from getting the vaccine, or that it might not work, or actually, I don't think I need the vaccine. I don't think I'm going to be affected by it. So if you have other responses, please add those again in the chat box. Again, pick your 3. And in 10 seconds, we're going to close this poll and see what our audience is telling us in terms of the specific attitudes about vaccine in your community. As we close the poll and waiting for the responses here now, And again, sometimes there's a delay as we're still waiting to make sure we capture your responses. Very interesting. So you can see where what's really highlighted here, 61% are saying mistrust of the vaccine development. Also, 59% are saying fear from harm from the vaccine. Yet some positive, 48 and 42% are saying the vaccines can work to protect the community. And I think it's also very interesting that we see 42% noted that the vaccine, they would take the vaccine after someone they knew had received it. This is such valuable information and helps us really understanding what you're facing as you work with these vulnerable communities. If we could go to the next question, and this is our last polling question for this today. We really want to understand what are the specific barriers to getting the vaccine into arms in the vulnerable community members that you're working with. Again, if you pick your top 3 choices. Again, don't forget to hit submit as you make those selections. This is critically important information. We already heard from our Chicagoland partners and panelists some of the barriers and challenges that they're seeing. Again, one of the things I think you'll note and we heard was issues around need to use the computer to register for the appointment was one of the things I think we heard from Marina. So again, if you'd make your selection in 10 seconds, we're going to close this poll. Again, don't forget to hit submit. And we'll look at the results here as we get the final responses. Please add any other additions into the chat box. Again, we're capturing all of your great wisdom in our chat box too. And we really appreciate this time that we can hear and learn from you. So again, we have a little bit of pause here, and here are our results. So again, when we're looking at specific barriers, you see one that leaps out at us at 79% is do not know how to make the appointment or where to go. And actually saw a lot of questions around that in our chat. 76% unable to get an appointment. And then we see a range of other responses. 52% need help to use the computer to register for the appointment. So again, such valuable information. Appreciate you taking the time. This helps inform us all in our work together to reach out and make sure that those in our vulnerable communities are getting the vaccination. At this point, I really appreciate your time. I want to now invite all the panelists and Dr. Monroe to get back on screen. We're going to have a general discussion, and we're also going to be able to answer several of the questions that you have in our Q&A. So at this point, Dr. Monroe.
So thank you, Sharon. Let's make sure we have everyone back on screen with us so that we can move back into questions Q&A with our panelists. So I see folks starting to come on screen. Starting to get everyone back. Okay, so welcome back to our panelists, and let's open up for discussion among this group. And one of the things I want to start off to just open it up to any of you that would like to answer. Any reactions to what you just saw with the polling? I mean, were there surprises? Is this what you expected? I mean, these are our community-based organizations on the ground saying, here's our issues, here's what we're seeing. So let me just open up to y'all. Dr. Cohen, it looked like you were ready to jump in.
No, I can start. I mean, it reflects what we're hearing across the country. Honestly, it is. In terms of the registration systems and the scheduling systems, there's, they're different in every state. And, I wish that there were a simpler solution. And we are thinking through potential solutions, but it is incredibly frustrating.
Yeah, I think folks will continue to be interested in what CDC is doing to assist our state and local governments for smoothing all that out. One of the questions that has come in, because I do want to get to the audience questions, and there are a lot of those. There's some questions about the work in Chicago for our team from Chicago, and specifically around working with community health workers. Could you all talk about, are our community health workers part of this work? And if so, what part of the vaccine effort? A little bit more on the community health worker specifically.
I'm happy to speak to that. So Illinois Unidos has been working very closely with Promotoras de Salud to get not only messaging regarding COVID, so prevention, testing, contact tracing, but also as we move into this next stage of vaccine rollout, we're engaging with our promotoras, with our community health workers to also engage with community members that may have some challenges with accessing COVID vaccines, and specifically doing that phone banking and one-on-one discussions with our community members that may not have the ability to access technology to make their appointments. But we're also trying to think in some creative ways on how to use our promotoras de salud to also get the vaccine to where people congregate, live, and work. Rather than having this model of people calling for an appointment and showing up at a vaccination site, can we work maybe with employers, particularly those that employ large portions of essential workers, to maybe have a vaccination day so that people don't have to worry about taking time off from work, and they can just get their vaccine at the workplace. Likewise, we've been engaging also with faith-based organizations, as well as community service organizations that are not necessarily FQHCs, but people that do other work. For example, folks that help with census numbers. Can we engage with groups like that to get people vaccinated, again, where they live, where they work, and where they congregate?
Yeah, that's an excellent answer. Thank you. So, Dr. Cohen, there are a few questions about the funding. As you can imagine, folks are wanted a little more information about the 10% that you talked about, and I know you guys are putting out more information, but specifically a question about any allocation for rural areas. And could you speak a little bit about what we're facing in our rural communities?
Sure, yeah. So rural communities are another very hard to reach population, not simply, well, especially in the setting of our current vaccine products and some of their storage and handling requirements and the number of doses that were required to send to each location. So in some of these more rural areas, it can be hard to have doses that stay there, because if they're not used, they're going to expire. And so there's actually a separate part of our what we call the jurisdictional playbook is focused on reaching rural communities. And we're hoping that some of the efforts that you're hearing about, when you hear that like FEMA is going to get involved in other types of things, that we can use mobile, we can support jurisdictions. Jurisdictions know best how to get to those communities and where those communities are. What we could potentially bring at the federal level is we can leverage some of our assets to support the physical components of reaching those communities. And then we would need community-based organizations to connect with the community and get out the word and make sure that people are aware of a potential campaign. One of the biggest challenges we're facing, as I'm hearing about, is the number of doses that we have available. We would love to be able to, the appointment scheduling is not only because we want to make sure people are getting safely vaccinated with strong social distancing measures in place, but it's also because we don't want, 1,000 people to line up and have 100 doses. And so it has been, frankly, somewhat of a mess in many places. And I think as we have more doses, we can be more flexible and have some of these open clinics where you show up and everybody knows that it's that day. But we need to have enough doses to reach the people who we can access easiest that way.
Yes, we're all going to be happy when more doses are available, no question about that. For others, for Sheila or others that might want to jump in on this one, a question about, we're talking about the vaccine hesitancy and particularly in communities of color. The question is, how do you start the conversation? Do you want to drill into that a little bit? This is a fine-tuned question.
I think that, you know, the way that we've approached this, and to Marina's point about the value of community health workers, I can't state that enough. Our staff, we consider them to be community health workers and have for years. So when COVID came, I mean, for better or worse, we had the skill set in place already. So I would say that, you know, approaching folks where they naturally congregate is part of our strategy. So as opposed to, and I go back to even what Marina said about how to distribute the vaccine, like getting the vaccine distribution happening where people are anyways, serves two functions to me. It's accepting people where they are and meeting people where they are, but also limiting interaction and socializing in spaces with foreign people. Not foreign as in outside of this country, but foreign as in limiting your circle and having your own bubble. So, I think that our approach to starting that dialogue is very similar, and we try to do education in as informal as possible so that people feel comfortable sharing their concerns and getting frank dialogue that's respectful about those concerns. So I would say, you know, we approach it where folks are, barbershop, corner store, wherever folks are. That's how we do our outreach anyways. And we just meld this right into our normal interactions with community members.
Thank you for that. That kind of leads to, and Dr. Cohen, this is actually specific for CDC, whether CDC is working with faith-based organizations. Can you talk a little bit about the work that you're doing there and how the faith-based organizations can be helpful?
Absolutely. Yes, faith-based organizations are another key partner, another trusted messengers. And so we are working with a couple of large faith-based organizations in terms of, you know, using our CDC messages and materials to communicate with through their communities. But a lot of faith-based groups are saying that they want to host and sponsor vaccine sites. And that is a great way to bring vaccine closer to people. And I am hopeful when we have enough doses, some of this funding from this jurisdictional funding can be a way for those faith-based organizations to access the support they need. We're seeing a lot of really good partnerships between churches and large health organizations that are setting up clinics in their or vaccination days, either outside in their social halls. And so we're hoping that expands.
Very good. And while I have you, a quick question about if you can say anything about a practice of giving the Pfizer vaccines, the second dose of the Pfizer vaccine at 17 days. There was a question about that.
So this has been a large miscommunication that we are trying to clarify, and then our clarifying language got somewhat misinterpreted. But so the recommendation is to get the Pfizer vaccine at 21 days. The grace period goes down to 17 days, but that was really just to sort of say, if you get it at 17 days or more, it counts. But the recommendation in all of the clinical studies looked at 21 days. Now, if you were to say, I can't get it at 21 days, I could get it at 28 days or 17 days, I would say get it at 28 days. So it's 21 days, you know, or days after that. And I think what happened was the grace period, which is really like, so that when you get your certificate or, you know, for proof of vaccination, that grace period is allowable. But I think a lot of scheduling applications used that 17 days as the window to schedule. So hopefully a lot of that's been clarified recently.
Yeah, well, thank you for that. There's a lot of confusing information. So for all of you in Chicago, there's a question for any of you that wish to take this is, how are you addressing the rural and the urban divide in regards to the internet or transportation, some of those barriers to access, and both to information and to the vaccine? Who would like to take that?
Yeah, I mean, I think it's, I could jump in, and Sheila, if you want to just add anything that I might leave out. So specifically talking about the in urban areas, obviously there's deserts, health deserts, pharmacy deserts, right? And so one thing that we're trying to do, working both through the Vaccine Core Partnership and through the Racial Equity Rapid Response Team that is actually housed within the Chicago Department of Public Health, is to try to think creatively, how can we get people to vaccination sites if one isn't in their particular neighborhood, in the absence of sending pods to their neighborhoods, right? And so we've been working with some of these ride sharing agencies. So Lyft, for example, works with one of our community clinics and provides transportation to people to and from the vaccination site. And then in terms of messaging, I think that there's another piece. This is where technology also becomes a barrier. There's a lot of folks that don't access social media and that don't access email. And a lot of the information they may get while they're at work or while they're just busy doing things in their day might just be as simple as a radio, or maybe a flyer that they saw at their local church or at the supermarket. So a lot of the messaging that Illinois Unidos has been doing has been trying to engage with radio, and also just providing pieces of paper that are available in a supermarket, in a church, in a community service organization that gives them clear information of COVID. And we're right now also working on info sheets on COVID vaccine, frequently asked questions and where to get it, how to get it, all of that. Those are
Very
some of my
good.
thoughts.
Thank you. I got to tell you, the hour's flying by. One last quick question, Amanda, to you. If someone has an asymptomatic case of COVID and they get the vaccine, will they be harmed?
So the short answer is no, and that is the full answer. But if you know that you are carrying COVID, even though you're asymptomatic, we do not encourage you to get vaccinated because you could transmit it to other people. So if you have had a positive test, even if you're asymptomatic, wait that time you're supposed to. I think it's 10 days after the positive test before getting vaccinated, but it will not cause harm. There is, we are looking into whether or not you may have more local side effects. I actually got my first dose yesterday and have a sore arm and had a little bit of fever this morning. And we're hearing that people who have had COVID previously, that may be more intense, but it is still very self-limited. It lasts a day or 2 days, and people are recovering quickly. So no, please, there's no harm in having had COVID and getting the vaccine.
Very good. So, well, this has been a really interesting hour, and as I said, it's really moved along quickly. I hope everyone will continue. We want to have a little bit of a call to action here as we thank everyone, but I do hope that everyone will continue in the audience to model the way from what you've heard. Follow the 4 W's. Wear a mask, wash your hands, watch your distance, be wary of crowds, and then of course get your vaccine as soon as it's your turn. Keep on connecting and collaborating for the most effective collective action that we can all come together. Keep up your effective communication in your communities. You've heard a lot about that today. It's low tech and high tech and everything in between around the COVID-19 prevention and vaccination. And I would add listening with empathy. And then remember the CDC toolkit. It's also on our website, on our resources page. We've got a link to that for whenever you might need it. And so we'll wrap up with a hearty thank you to all of our guests for your generosity for joining us today. And to you, our webinar audience, thanks so much to everyone for taking your time today and being with us. Thank you for your incredible questions. Today's slides and recording of the webinar will be available on our web resource page. And as you leave the webinar, a question will pop up asking what topics you'd like for us to cover in future webinars. So feel free to let us know what you'd like. Just remember that together our impact is in fact greater. And thanks so much, everyone. We look forward to seeing you at our next webinar.